What if a machine could predict the future, warning you decades before a life-changing heart attack, a paralyzing stroke, or the loss of precious eyesight? What if you could intervene and prevent those terrible things from ever happening in the first place? I'm Zane, a board-certified primary care doctor, and this blood pressure machine can help you do just that. How? Because of the one thing about high blood pressure that makes it so incredibly dangerous. Most people can't actually feel when their blood pressure is high. So high blood pressure, or hypertension, quietly destroys vital organs without anyone knowing until it's too late, often causing cardiovascular disease that manifests as organ damage and a shortened lifespan. Checking our blood pressure is the only way to know if this silent damage is happening, if these time bombs are ticking under our noses. Seriously, it's that simple. A device like this that you can just buy online can basically give you a window into your body, letting you intervene before hypertension does major damage. So in this video, I'll talk about the 3 types of people who can take charge of their health by checking their own blood pressure. There's a good chance that you're one of them. I definitely am. But stick around because then I'll go over what the numbers actually mean and how they translate to people's health. And then, this part's important, what you can actually do about it, because that's the real reason for checking our blood pressures in the first place. Hypertension is so common that it's sometimes called essential hypertension, as if everyone's supposed to get it. Billions of people are going to develop hypertension, and the only way to know right when it's happening is to track your blood pressure over time. Intervening and correcting high blood pressure as early as possible can add years, even decades to your life, not to mention prevent tons of health problems that lead to things like dementia, immobility, and chronic pain. There's certain groups of people whose blood pressure is normal now, but they're really prone to having high blood pressure and also more likely to experience its negative consequences. People who have certain risk factors like family members with high blood pressure, more stress, or sleep apnea are also more likely to have hypertension because of biochemical processes like the activation of different hormone systems, the fight or flight response, and endothelial dysfunction. And even though it's impossible to change something like your family history, these next few are under the control of most people. Addressing one risk factor could potentially improve others, like how increasing physical activity or cutting back on processed foods can help with diabetes and weight, which themselves are risk factors. If you haven't already, check out this video that I'll link to on exercise alternatives, where I talk more about BMI and blood pressure, along with guidelines on physical activity. So why is this important? Well, 1 in 6 of us have 3 or more of these risk factors, which multiplies the risk of hypertension and cardiovascular disease. And pro tip, it can be easier said than done to change a lot of these risk factors, but you can form good health habits by using these tricks. Giving yourself an immediate reward, trying to make the habit easy, or using a habit tracker and trying not to break the streak. These tricks and a lot more can be found in the book Atomic Habits that I'll put a link to in the description. White coat hypertension is when people's blood pressures are higher only in a healthcare environment like the doctor's office, but they're normal otherwise. So monitoring blood pressure at home can help separate white coat from true hypertension. It's named after the stereotypical doctor's white coat because for some people, being in a doctor's office can be stressful. So I sincerely appreciate you letting me onto your screen. This may not be surprising, but white coat hypertension might be a warning sign of what's to come and can sometimes turn into full-on hypertension. It's okay though, because there are ways to treat hypertension with and without medicine. And there are also ways to prevent it, which I talk about in some of my other videos that I'll link to. A lot of research out there shows that white coat hypertension doesn't really affect long-term cardiovascular and overall health, but there's still a small chance that it does. Way more research is needed because we don't really even know whether treating it would make a difference anyway, so stay tuned. The white coat can raise blood pressure, but the opposite is true too. Yeah, some people's blood pressures are actually lower in the doctor's office. It varies based on the study, but about 1/5 of people have what's called masked hypertension, and their true blood pressure is high when they're at home and living their normal lives, but when we measure it at the doctor's office, it's temporarily low. And yeah, just like with white coat, home blood pressure monitoring can reveal this otherwise hidden diagnosis. The overall risk in people with masked hypertension is similar to the risk in people with typical hypertension, but this time there's not enough research to help us figure out the best way to treat it. And if at any point you or someone you know is not sure about their blood pressure, what it means, or how to check it, you can always ask a local healthcare provider, a nurse, or a pharmacist for help. So if you already know your blood pressure is high, why check it at home? Well, here are 3 main reasons. Home blood pressure monitoring leads to better blood pressure control, which means less side effects from medications and less organ damage from high blood pressure. Checking blood pressures before clinic visits helps doctors more easily and accurately determine if someone's blood pressure is controlled. This helps people be on the correct dose of medicines for their level of hypertension. With the huge increase in telemedicine since the pandemic, home blood pressure monitoring helps patients' healthcare providers adjust their medication doses remotely in response to things like changes in lifestyle, weight fluctuations, situations and clinical treatments. And home blood pressure monitoring gives people important feedback about how both medication and natural treatment with food, exercise, and other lifestyle changes impacts blood pressure, and it can motivate people and help them stick to their treatment plans. A blood pressure machine essentially tells you two basic things: whether you have high blood pressure, and if you do, how bad it is. Okay, so true or false? Normal blood pressure is 120/80. If you think you know, leave your answer in a comment below. Answer: false. Normal blood pressure for adults is under 120/80, so once either the top number gets to 120 or the bottom number gets to 80, it's no longer considered normal. But real quick, let's go over what the top number and the bottom number actually represent and what the numbers mean for people's health. The top number and the bottom number are called the systolic and diastolic blood pressures. The diastolic pressure is always the lower number, and that's easy to remember because it's the one on the bottom. It's the pressure when the heart's relaxed, and the top number, the systolic pressure, is when the heart's beating. So a reading of 110/70 means a systolic pressure of 110 and a diastolic pressure of 70. Blood pressures that remain too high for too long cause coronary artery disease, which is when not enough blood gets to the heart, eventually leading to a heart attack. But whether or not blood pressure medicines are recommended depends on the person's history and the risk of cardiovascular disease, which includes their stage of hypertension. And the higher the blood pressure, the higher the risk. It falls into 4 categories, starting with normal blood pressure. As we talked about, normal means a systolic pressure under 120 and a diastolic pressure under 80. If the systolic gets up to the 120s, we're in the elevated category. People with average blood pressures in the normal range should keep watching their blood pressure periodically and going to doctor's visits at least once a year to have their vitals checked by a professional too. Healthy eating and physical activity can help keep people's blood pressure normal for as long as possible and for life in some people. People whose long-term average blood pressure falls into the elevated category can have up to a 50% higher risk of coronary artery disease compared to people with normal blood pressure. Pressures are counted as elevated when the systolic is in the 120s, but only if the diastolic pressure is still normal and under 80, so this category only applies to the systolic pressure. A person's risk factors often determines the course of action when it comes to elevated blood pressures, and treatment always includes a healthy diet and regular physical activity, and medication might not be started unless someone has a certain elevated risk. A conversation about treatment should always happen one-on-one with a trusted healthcare provider because a lot of different factors are considered when determining someone's overall risk, and each person's situation is different. Once the systolic pressure gets into the 130s or the diastolic pressure gets into the 80s, then we're talking stage 1 hypertension, where the risk of coronary artery disease almost doubles compared to people with normal blood pressures. The treatment for stage 1 always includes lifestyle changes like diet and exercise too, and people in this category might start medication if their healthcare provider recommends it. People with stage 1 hypertension are more likely to be on medication compared to people with elevated blood pressures. Stage 2 hypertension starts when the systolic pressure hits 140 and anything higher than that, or if the diastolic pressure gets to 90 or higher. The risk of coronary artery disease at this stage is more than double that of people with normal blood pressure, and the risk goes higher as the blood pressure gets higher. People in stage 2 hypertension usually receive medicines from their healthcare provider, but lifestyle changes are still the foundation to treatment because they can minimize the medication required to treat hypertension at this stage. If the systolic and diastolic pressures fall into 2 different categories, pick the worst one. So 128/94 would be considered stage 2 hypertension based on the diastolic number. People whose blood pressures are extremely elevated should seek care right away, especially if the systolic gets to 180 or higher, or the diastolic gets to 110 or higher, or if the high blood pressure comes along with other concerning symptoms, including but not limited to chest pain, nausea, trouble breathing, or neurological or stroke signs. Be sure to talk with a healthcare provider, a nurse, or a pharmacist to confirm that your readings are accurate and to get a plan that's appropriate for you. A doctor in a video is not a form of healthcare. The decisions that affect our health should be well informed, and that starts with knowing our true risk factors, especially blood pressure. So I hope this video helps explain why checking blood pressure is so important, what the numbers actually mean, and how to act on that information. A blood pressure machine is a critical part of this process, and anytime we depend on equipment, it's important to know exactly how to use it. So if you're interested in learning how to ensure that your blood pressure machine is as accurate as possible, or even how to find a machine that's reliable, consider checking out this video that I made that covers just that. Peace, and see you in the next one.